Just how big is 3% of the total American population? As many of you are thinking, this is not a very large amount. According to the Health Press, Alan Minter states that 3% of American population is affected with this disease called psoriasis. Unfortunately, I happen to fall among that 3% group. Today I plan to inform you about an incurable disease called psoriasis, the treatments offered for this disease, and how it is to live with it on an everyday basis. Let's begin by understanding what psoriasis really is. So the question is, what is psoriasis in general? This is a skin disorder of lesions of scaly, dry patches of skin. Skin cell production is increased, causing the buildup of skin cells on the surface. This causes raised, red, itchy plaques of scaly, dry skin. The skin disorder has been around for quite some time. As you can see in the textbook of psoriasis by Peter C.M. Kirchhoff, Robert Willen was the first person to give an accurate description of psoriasis in 1809. So what causes this defect in the skin? According to James Mitchell Crowe in Psoriasis Uncovered, the skin disease affects the keratinocytes. These are the skin cells that predominantly form the layer of skin known as the epidermis. Keratinocytes mature 10 times faster than normal, non-diseased skin cells. This defect causes the skin cells to improperly mature, which results in the raised plaques called psoriasis. So who can be affected by this disease? Anyone can be affected, although it's said to be hereditary. Psoriasis can occur at any age from 1 to 80 years old. So how can this painful dry skin be treated? What treatments are there for this disease? The most common form of treatment is therapies. Two popular types of therapies for psoriasis includes phototherapy and systemic therapies. Evolution of targeted phototherapy for psoriasis states that phototherapy is a safer treatment and an effective way to treat this disease. This therapy uses narrow ultraviolet light to target the affected cells. Systemic therapy affects the entire body. This is simply a medication like methotrexate that targets the whole body instead of only several skin cells. Topical creams and lotions are another form of treatment to the skin disease. Dermatologists recommend creams for the skin to help with the inflamed patches. Believe it or not, coal tar has been approved by the FDA as an effective treatment method for psoriasis. I have gone through the stages of using topical creams and lotions for my skin, however, it never seemed to ease the pain or to help tame the flare of my psoriasis. Injections are a way of treatment for more serious cases. Stelara, Humira, and Enbrel are a few of the treatments offered as injections. I'm sure most of you all sitting in this room today have heard the commercial, Humira can help. This is a treatment for the disease that I currently use. Although there are treatments available and research being done, there is no found cure for psoriasis. As I mentioned, the method I use to treat my psoriasis, and considering that it is unfortunately incurable, let me talk about how it is to live and deal with it every day. Living with psoriasis on an everyday basis. First, it is very uncomfortable and painful to live with. The raised, dry patches of skin are utterly painful. As in a lot of people with this disease, it likes to form in the cracks and crevices. So think about a tiny paper cut between your fingers. It's painful when you spread it apart because the paper cut spreads apart with your fingers. Now times that by 30 and have patches of red inflamed skin between cracks and crevices. Along with being painful, it is also embarrassing. People see your skin and they laugh and make fun of you for your skin not looking like theirs. Growing up, I dealt with this a lot. Being a kid and having funny looking skin was hard, very hard to cope with. Also, treatment is excruciating. As I mentioned earlier, I'm on the injections called Humira. I have to be injected every other week throughout the year. The shot is nowhere near what a normal shot feels like. The pain of the medication running through your body is agonizing, feeling like fire going through your entire body. There are also side effects associated with this skin disease. Oftentimes, depression can be associated. As it is embarrassing to live with, it brings down self-esteem and self-confidence of people who have to live with the skin disease. I know this on a first-hand because I have dealt with it and had to live with having ugly, painful skin, and it's not fun. In conclusion, psoriasis is a tormenting, discomforting disease that is horrendous to live with. Today I described to you the entity of the disease called psoriasis, the treatments that are available for this disease, and how hard it is to live with the skin disease every day. Can you imagine having skin like that of the pictures that I presented to you in my presentation? Would life be hard to deal with as you had to try to hide and cover the painful, unattractive patches? Well, coming from someone who has to deal with it every day, it is hard to live with. Although researchers are searching for a cure for psoriasis, one has not been found yet. October 29th is World Psoriasis Day, where awareness is prevailed. Do your part and spread the awareness of this skin disease called psoriasis to help find a cure for this awful disease that myself, my mom, and many others are dealing with. Thank you.